again, this is not warning about what might happen. The hospitals in the state are full, including the pediatric hospitals. And the case numbers are rising every day. They've got 6,000 and 7,000 new cases every day. That means, 500 hospitalizations over the course of the next few days, according to the state medical director. When the flagship hospital in the state has announced that every hospital in the state is at capacity, when they're announcing they're between 5 and 10 days away from total failure of the hospital system in the entire state, this is trouble. I mean, total failure of the hospital system doesn't mean the hospitals close, but it means if you call 911 and you can get yourself an ambulance, the ambulance will turn you away at the hospital. Again, that was the word this afternoon from the University of Mississippi Medical Center, which is in Jackson, which is in the state capital. Today, also in Mississippi, NBC reporter Ellison Barber went about 150, 200 miles southeast of Jackson down to Ocean Springs, Mississippi. It's vaguely near Gulfport, Mississippi, right on the Gulf Coast. Ellison went there to try to understand what this kind of situation in Mississippi means on the units, what it means for doctors and nurses in Mississippi right now who are in the midst of what is a national level crisis, trying to hold back this tidal wave of new, very sick patients as the state exhausts its resources. I mean, part of what Ellison heard is that the fact that so many younger people are getting so much sicker now is driving a lot of how hard this is right now on doctors and nurses. Here's Dr. Ijlal Babar. He's the director of critical care at Singing River Health in Ocean Springs, Mississippi.
There are often family members who want to talk to us, and one of the most difficult things is discussing end of life and worsening status with family members of these young patients. So whereas before we were talking to children of these elderly people who were often prepared in their minds for eventual demise, now we're talking to parents, we're talking to young spouses, and then they tell us that this patient has a 10-year-old or a 15-year-old, and it breaks our hearts. When you start talking about end of life with people like this, and in this age group, it's very difficult. It's very difficult. And the reactions we get are, some people are just dumbstruck, some people are angry. It just varies. And then, of course, we have to go and take care of these patients at the bedside. Dr. Baral was putting a chest tube in one patient, and then she's going to go to the next bed and put a chest tube in another patient. So you're basically going from one room to another, and at the same time you're getting calls from the ER about more people rolling in. So it's just constant. I wish our governor would step up and say very clearly how important the vaccines are. I think that everyone, in every way they can, should come out and say it so that people can be encouraged to go and get vaccinated. Because otherwise, until it hits you, you don't realize what it means. When your own loved one is dying, that's when it means something.
Dr. Ijlal Babar is the head of critical care at Singing River Health in Ocean Springs, Mississippi, again, down by Gulfport, Mississippi. He went on in this interview today to say that one of the challenges that they are sort of growing into now is nurses who are working so hard and working, double time, triple time. Nurses finding that ultimately they cannot keep working in the ICU. They can't take it anymore under these circumstances, in part because of the frustration, as he put it, that almost all of this suffering could be prevented if people just got vaccinated. Frustration over that is driving nurses to leave critical care at this critical time. Also, just with these